And coming up, do you or your kids vape? A new study finds that it leads to a much bigger risk of heart failure. How to avoid this health problem? Our cardiologists answer when we come back.
Welcome back. One of the biggest marketing strategies of vaping is the claim that it's healthier than cigarettes, but vaping comes with its own set of problems.
A study has found vaping leads to a big risk of heart failure. I wanted to find out more about this, so I spoke with cardiologist Dr. Fahmi Farah. Check it out.
Yes, a latest study that was published in the American College of Cardiology has shown that it can have detrimental impact on your heart, and it can be a cause behind a particular type of heart failure.
Yeah, that's a 19% higher risk of heart failure associated with vaping. We're seeing a lot of young people in their 20s, 30s having an increased risk of heart attacks. Could this be part of the reason?
It's quite possible. The rate is quite alarming. As you mentioned, almost 20% increased rate of heart failure. And yes, you're correct. Teenagers and adolescents are even now turning to vaping. And, time will tell what kind of impact that generation is going to have because they're getting exposed to these chemicals so early on. So it is concerning.
Yes, and the study's lead author says that as more of these studies are coming out, we're finding out that e-cigarettes are not as safe as people used to think. What advice do you have for parents?
I would advise parents to talk to their children, non-adult children, like adolescents and teenagers who are being exposed to vaping, that it's not as benign as previously thought, and they should advise them and discourage them from these usage.
And what more about this study can you explain? It had 175,000 people that they tested.
That's correct. The study found that the rate is higher in a particular type of heart failure called HFpEF. So what that is, heart is a pump, and the pump, its job is to squeeze blood all day long. That's how it survives and functions. So there's a particular type where the heart, just as important as it is for it to squeeze, it's also important for it to be able to relax. And the particular type of heart failure we're talking about is impairment in that relaxation of the heart. So the heart is becoming stiffer, the muscle, and as a result, it's not able to relax as well. So that's called preserved ejection fraction type heart failure. And that's the particular kind that's on the rise that's been associated with e-cigarette smoking.
That is very alarming, and this American College of Cardiology study comes also as the Cardiometabolic Institute cites diabetes, hypertension, and obesity as other risk factors there too. So what are teens and young people facing right now with all of these combined?
Those risks are still there, of course. There's family history as well. And, in our country, especially in the United States, diabetes, hypertension, obesity, all of those are risk factors. And these teenagers, on top of those risks, they're adding one more, which is e-cigarettes. So I do worry about that generation and what the long-term impact of it will be. It is concerning.
Dr. Farah, in your view, what are some solutions to this problem?
I think public education is very important early on. Sometimes we tend to think that young people are not as exposed, but that's not quite true. Studies have shown in the past that the damaging impact of hypertension, for example, starts to ensue a lot earlier than we think at a microscopic level. And so when we see young folks turning to vaping and things like that, my advice would be for parents to get involved, for media like what we're doing right now to encourage public education and give the right information to the right people so that we can discourage our young folks from being exposed to harmful things.
Cardiologist Dr. Fahmi Farah, thank you so much for this important update.
Thank you for having me.